The Frontline Worker Pay Working Group will come to order for Thursday, August 12th, 2021. A quorum is present. Senator Murphy, would you like to move the minutes of August 10th?
Mr. Chair, I move the minutes of August 10th.
Any discussion to that motion? Seeing none, all those in favor, please say aye.
Aye.
Opposed, say no. Motion prevails and the minutes are approved. The first item on the agenda is a presentation from the Minnesota Department of Revenue, and Commissioner Doty will be doing that via Zoom. Commissioner Doty, are you prepared?
Representative Winkler, I am.
Please proceed with your testimony and identify yourself for the tape.
Okay. All right. Well, good. Let me make sure everyone can see here. Yeah. Well, good afternoon, everyone. My name is Commissioner Robert Doty, and I am the Commissioner of Minnesota Department of Revenue. The committee has asked that we do a presentation on what I would call administration or payment mechanisms potentially for a frontline worker program here in Minnesota. And so I'm going to kind of walk through what we've come up with for options for such a program here. So to start with, though, and I'd like to just to give a little bit of background on some of the work that we've done on this. So first of all, we have looked at a number of programs similar to this across the country. So we looked at programs in Louisiana, Indiana, Michigan, Pennsylvania, Vermont, Georgia, Maryland, Florida, and Oregon. And some things stand out that we can then take into consideration as we look at structuring our program here. So first of all, most of those programs are all administered either through the state's Department of Labor, the state's equivalent of deed, like we have here in Minnesota, and or in some cases directly from the Department of Revenues. So that's one thing to consider. Secondly, in some cases, the programs were administered to a broad range of frontline workers in various industry segments. And in others, they were very targeted, like maybe only to teachers or to nurses or some subset thereof. The payment amounts range from anything from as low as $250 per worker, like in Louisiana, to as high as $2,000 to specific categories of workers, like in Vermont, for instance. Each included kind of a specific time frame that the worker was required to work within the applicable industry from date X to date Y. So again, we looked at some of those things as we were looking at what would work here in Minnesota. What I'm going to walk you through is what we've come up with 6 options that we think we'd like to submit for consideration to the committee. And with that, let's jump into it. So before we get into the options specifically, right now, where we sit right now, there's a number of questions that clearly need to be answered and will have an impact on which of the models, if you will, that will work best for us here in Minnesota. So questions like who will get the payment? So which frontline worker categories or industry groups are we speaking about? What will that amount be? How will these payments be made? When will they be made? We've heard a lot of people who've testified say that their recommendation is that we make this as easy for frontline workers and they get this money as quickly as possible. So what does that look like and what does that mean? Are there collaborative approaches that we could use to set this up and to get these monies out? What is the eligibility criteria? We've talked a number about some of that. Will we use an income threshold? I should also say that in the majority of the states that we looked at, they did have some kind of income threshold that they used. Will the payment be a flat amount, or will there be some kind of a sliding scale? And also, will we include some kind of an appeal kind of mechanism in place? One of the things that the Department of Revenue and DEED were very involved with earlier in the year was business relief payments to businesses that had been adversely affected by the governor's closure orders relative to COVID. And we made sure that we had an appeal mechanism in place so that people could call and ask questions about, am I going to get a check? How come I'm not going to get a check? I think I'm qualified. And so I also just put that out there as a question because this kind of disbursement potentially will lead to a lot of questions like that. And there will need to be some mechanism in place to respond to those kind of questions. Will we consider full and part-time? And how will we partner with employers in making this work? Next slide, please. So as we were looking at this and kind of putting these options together, we identified 3 main responsibilities, which you'll see over and over in these 6 options. First, the identification component relative to frontline workers. Who will those people be, and how will that occur? Next would be the verification process. How will that occur? How will we verify the eligibility requirements? And then finally, the actual distribution of the payments. How will that be done? Next. So these are the 6 options that we have kind of come up with that we're gonna go through briefly here, and then I'll walk through each of these in detail going forward here. So first option is, and you heard me speak about the business relief payment model and what we did earlier in the year. That's what this first option is really modeled after, where the state would collect and verify worker data based on established criteria, and the state would then also distribute payments directly to workers. Okay, so in this case, and we'll see it going forward, the state would handle all 3 of those responsibilities that I mentioned earlier. Option number 2 is where the state would potentially contract with a third-party vendor that would receive validated worker data from state agencies and distribute that, and the third-party vendor would distribute that the payments directly to workers. And this would be similar to how the vaccine incentive program has been set up with U.S. Bank, for instance. I'm not saying that's who you'd work with necessarily, but that's how this would be modeled after. The third option would be where the state would award grants to businesses to distribute to frontline workers based on established criteria. Okay. Number 4 would be similar to this, but employers would collect and verify worker data based on criteria and distribute to the frontline workers. And then in this case, the state would reimburse those businesses for monies that had been paid out to the workers. Number 5 would be where the workers submit an application, like an online application of some sort, and the state agency would verify and distribute the payment. And when I get to this one later, this would be how the Louisiana model is kind of set up. And I'm going to talk a little bit about that. And then finally, something that, just trying to think out of the box a little bit, that's very different than all of these, is that where the payment would be incorporated into the tax system, and it would be set up as a refundable credit on a person's tax return. So we'll talk about that. And each of these options, what I'm gonna just walk you through what they are in detail, and then also look at some things to consider about each one. I'm not saying any option is good, bad, or whatever, but definitely something to consider for each of these. Next slide. Okay, so the very first option, like I said, is similar to what we did for the business relief program. And this is where the state would directly distribute payments to workers. So like I said, in this case, the state would handle all 3 of those main responsibilities of identifying, verifying, and making the payment. The state agency would automatically identify eligible workers through existing databases that we would have access to or have to obtain access to. We would verify their eligibility, and then we would actually issue checks directly to individuals. Next slide. Some things to consider about this first option is one, this is probably, we say the path of least resistance for frontline workers. This is probably the easiest for frontline workers. There's no action that they need to take other than receipt of the payment. One of the issues with this one, which would be similar to what we found with the business relief payments, is that this potentially causes confusion and uncertainty around eligibility. So this is where you would have people would call with questions about, am I going to get a check? Am I eligible? How come I'm not eligible? Things like that. And so that would be one of the issues to consider here. This option also would require significant IT development and testing by various state agencies who would be part of this. Because our systems really aren't set up for this type of distribution. So this definitely would require some IT work, and that would also make would increase the risk that we would not be able to get these out necessarily before the end of the year. So that would be something to consider as well. And then this option, because of all of the responsibilities would be on the state agencies in particular, this would require that the state agencies involved would have to prioritize this work over the other work that they currently have, particularly that's come from the recent legislative session. So again, things to consider. Next would be the direct distribution of payments by a third party. So in this case, the state or the worker, depending on if we would use like an application process here, would be responsible for the identification. The state would verify, and then in this case, a third party would issue the payment. So again, like I said, this could either be the state or the worker themselves applying for this. We would still be responsible for verifying eligibility requirements. The third party would process and issue the checks, and then again, like I said, this is similar to the COVID vaccine incentive program that has been set up currently. Next. Some things to consider about this one, though, is in this case, obviously having a third party issue those checks, it takes some of the pressure off of the state agencies to get those checks out in the midst of the other stuff they're doing. So that's something to consider here. This option would probably make it much easier to ensure that those checks or payments were received before the end of the year. The problem, not the problem, but a challenge with this option is that this would probably require some increased administrative costs that would have to be part of an appropriation that would go with the legislation potentially. And there would have to be some kind of vendor selection process that would have to be set up for this. Maybe that's an RFP process or something, not sure, but just something to consider here. Next slide. Next would be the idea of grants to employers. In this case, the employer would be responsible for the identification. The state would still do the verification of eligibility, but the employer would make payments to the employees. So like I just said, employers would identify the employees that would be eligible for the payment. We would verify, and then we would make lump sum payment directly to the employers. And then the employers would then make those payments directly to the employees. And again, we would just have to make sure that there was some kind of a process in place to make sure that we could verify the eligibility, if you will, eligibility criteria from the employers to make sure that this was being done fairly. Next slide. So in this, some things to consider here is that, again, like I said, the responsibility for making payment would be on the employers, not the state. This would allow employers to more efficiently identify who those frontline workers are, in particular occupational categories that meet eligibility requirements. And this is important given that this has come up in a number of, as part of the discussions with the committee. We've heard this from several testifiers that it may be difficult to drill down beyond some of the top line categories to get to some of those occupations and workers that we really want to make sure that we can honor through these payments. So this would make that a little easier because the employers would be in a much better position to do that. We think this may, though, cause some additional challenges or burdens that, particularly for smaller employers that may not be able to administer this type of a program. And then we definitely feel there would definitely be a need for a verification process to ensure that businesses are fairly distributing those payments to eligible workers. Next slide, please. Next would be the idea of a reimbursement process to employers. And in that case, the employer would be responsible for the identification and the payment, but then after the fact, the state would be responsible for the verification. And this is similar to the Minnesota Education Assignment of Income Tax Refunds that we currently do right now. Next slide. So the things to consider with this reimbursement process, and this is similar to the grants, just with a slight twist. The responsibility for making the payment would be on employers, not the state. Employers would be able to quickly identify and pay their frontline workers, and then because they're seeking reimbursement from the state for those payments. This would allow employers to get payments to frontline workers faster, and then, like I said, rely on a reimbursement from the state. We see maybe a challenge for some employers who may have, this may present like a cash flow constraint for some employers, again, maybe potentially smaller employers who employ frontline workers, so this may not work for them. And again, as with the grant process that I mentioned earlier, we think a verification process for employers would also be important to have in place. Next. In this case, what we have is the worker submits an application for payment. And this is and like I said, this is modeled after the Louisiana program. And in this case, the worker would be responsible for identifying who they are. And so they do that through an application process. The state would verify, and then the state or a third party, depending how we want to set this up, potentially would distribute payment. And so, like I said, in this case, the responsibility is on the worker to make an application, and that application could be either online, could be paper, could be by phone, but it would start with the employee, initiating that. The state would verify applicants to ensure they meet eligibility requirements, and then, like I said, the payment could either come from the state or from a third party. And just briefly, just pause for a second and just to give some context on the Louisiana Frontline hazard pay program. Louisiana they used a very broad base of worker categories. They have a number of categories that cross a lot of different business sectors. They gave out payments of $250, and the requirements were based on first, you had to make less than $50,000, so they had an income threshold. You had to work at least 200 hours within that business sector, and they again you had to work that time over a designated time period. So from time A to time B, you had to put in that 200 hours. They made no distinctions really between full and part-time, as long as you clocked in those 200 plus hours. You had to be a Louisiana state resident. And they also allowed eligibility for workers who had been laid off, have collected unemployment, but as long as they were able to, they were able to show they they clocked in that 200 hours. And they also included self-employed workers. So if you were a self-employed individual and your business gave goods and services to another business that employed frontline workers, you potentially could be eligible for the payment as well. So that's kind of how their program was set up. Some things to consider for, next slide, please. Thank you. Just some things to think about. So an open application would allow for a lot more people to apply, which would potentially cause an increase in the number of unqualified applicants, which would increase the times for verification that would have to be put in to kind of sort through those who are eligible and for those who are not eligible. We also know that there will be workers who won't feel comfortable filling out an online application, so that's something to consider as well. And we also recognize that anytime there's an application process, particularly one that's mainly going to be online, that there will be access issues, there will be language issues, so this would require you would have to have multiple ways to apply. So like I said earlier, whether that's online, whether that's by paper, or whether that's by phone, you'd have to have all those available, and you'd have to have some way for the language consideration to be taken care of. So those would be things to consider for this one. Next slide. And then the last option, like I said, is something very different than all of them, and the whole idea of integrating this into the tax system. So in this case, the worker would be the one who would start the process, because they would take care of, they would self-identify, the state would pay, and then the state would also verify. So the workers would apply for a tax credit when they file their 2021 individual tax return. The payment would be a refundable credit that would be included in the worker's tax refund, or would reduce the amount that they owe. And the verification would follow kind of existing audit criteria. And the payment would be made before the verification could take place. So that's why you see this one very much out of the normal order. Next slide. So the things to consider with this one, first of all, this would be the least challenging to administer, since the system's already in place, and it would just really be adding almost like a checkbox on the tax return, which we could do pretty easily. Probably the negative part is that this payments wouldn't happen for sure until early 2022, when people file their 2021 individual income tax returns. Like I said, this would be a refundable credit, so that would mean you wouldn't get a check. It would either reduce your tax burden, your liability, or would increase your refund. This would make it really challenging to estimate the overall amount of funding that would be required to for everyone who checked the box, if you will. And the other concern with this one is that workers may not feel that this was really a bonus or something that was really special as a result of their sacrifice that they gave. And they may feel this is just another part of doing their taxes. So that are the things to consider with this one. Next slide. And then finally, I guess the couple things that I'll just mention before I open it up for any questions would be that I think that as we looked at these various options, number one, I think that we assume that in order to get these out, that there's gonna have to be some level of risk that is accepted, and I mean risk of error, if you will. So, and I think that would go hand in hand with the idea of what does verification of eligibility really look like. For instance, are you going to verify 100% of every criteria for every applicant, or are you going to do that in some kind of a sampled kind of a way? I think that is really important. And I think that how we set the criteria and what those criteria are will, I guess I just want to underscore, I think have a big impact on if we are able to get these payments out to frontline workers prior to the end of the calendar year. So I think I wanted to throw those things out as things to really think about as we are putting this program together and going forward. So, Mr. Chair, I would conclude what I've got here, but open it up for any questions that anyone may have.
Thank you, Commissioner. Questions from the committee, and if you're online, Representative Frazier, go ahead.
Thank you, Mr. Chair. And thank you, Commissioner Doty, for the options that you provided here. Just a couple of questions. For the IT build out, I don't know.
Representative Frazier, is your computer muted?
I am muted. Let me do this.
And is your laptop also muted?
Yes. Let's see. How's that?
No, not hearing the echo now.
Okay, maybe it was me. Sorry. Commissioner Doty, in a couple of the options that you provided, you noted that there would need to be IT build out or third-party administrator added for the process. My question is, do you have an idea of what the cost would be for the IT build out as well for the third-party administrator? And is that would that cost likely be considered an admin cost that would come from the original amount of $250?
Commissioner Doty.
Mr. Chair, Representative Frazier, good question. I hate to give you this answer that is not really a full answer, but it depends, right? So the idea is that it would depend on the model of the program that's selected, quite frankly, which would dictate the amount of build out that might be required. I would say that, like with the business relief program, and again, I use that as an example because Department of Revenue indeed recently worked on that at the beginning of the year, and we definitely had a number of hours that had to go into building that out, and that was really building out through our existing tax system because again, you're using different criteria. The state systems aren't necessarily set up to easily do something like this. You have to kind of tweak them to do that. So it really will depend on what type of model that the committee decides on. And I think the way the legislation would be written would determine how that would be paid for, whether it would be a separate appropriation potentially, or whether that would come out of the 250 would be up to the committee and again would be dictated by how the legislation is set up.
Representative Frazier.
Thank you, Commissioner. And to that point, how difficult would it be to just integrate this process into the currently to the program that's already in place with the COVID incentive program that we have?
Commissioner Doty.
Mr. Chair, Representative Frazier, that's a hard question to answer because again, I'm not really an IT guru, and what I would say is that we could find that out. We could, depending on the type of model that we're talking about, how much tweaking would any of our systems need to be able to do that? It's not an impossible thing for us to get an answer to. I'm not able to give you that directly right now.
Thank you, Commissioner.
Representative New Brindley.
Thank you, Mr. Chair, and thank you, Commissioner Doty. This was extraordinarily helpful. As a follow-up.
Representative New Brindley, we're having a little difficulty hearing you, and I wonder if it might be easier if you're off camera and your internet might pick up your sound better.
Let's try that. Is that any better?
That is, thank you.
Perfect, thank you, Mr. Chair. As a follow-up to Representative Frazier's questions, are you familiar, Commissioner, if there are any products available from third-party vendors that are being used in other states for this purpose right now? Are there things that are available right now that we could use?
Commissioner Doty.
Mr. Chair, Representative, I would say I'd have to look into that. As doing the research that we were doing, I did not come across specific products that were being used right now. I think we could, again, that's an easy follow-up to do. I don't have that available right now.
Representative New Brindley.
Thank you, Commissioner. And along that same line, and again, clearly Representative Frazier and I were thinking along the same lines. Are there IT products available, or would this have to be a new build out specifically for our state, or are there products available that we could purchase and integrate?
Commissioner Doty.
Mr. Chair, Representative, again, that's one that we would have to look into. With the, again, I'll use the example of the business relief payments that we did. We did not have to create a totally new system at all. We just had to build out on the current system that we had. So I know that that's possible. How much work that requires, how much time, and the cost of that, I would have to really look into, and we'd have to get some more information for you. But we did not have to purchase a new tool or anything specifically. So I would suspect that that same logic could be used for this program as well.
Representative New
Mr. Chair.
Brindley. Okay.
Thank you, Mr. Chair. And thank you, Commissioner. I really appreciate that. This has been really helpful and insightful. I especially appreciate, I think you were really thorough with your things to consider. I appreciate that. And my last question would be, just for clarification, this presentation would apply to revenue if we did these payments through revenue. And I assume that this would have also applied to deed if we did this through deed.
Commissioner Doty.
Mr. Chair, Representative, yeah, I'm gonna speak for for Deed and Dolly in this respect. We've gone through these, and I think that the idea here would be where we say state would be potentially either one or a combination of the three agencies working together to carry that out. I would not necessarily see any one of the state agencies being responsible for all parts of a program. I think that the idea would be that the state agencies would work together to fulfill that program.
Senator Kiffmeyer.
Thank you, Mr. Chair, and thank you, Commissioner Doty, for your presentation today. I wanted to look a little bit more into the grants to employers option. It seems that when we have individuals, we just have a huge exponential increase in just the numbers. Considering we've had presentations from employers, it seems as though they have a lot of good data already from nursing homes, long-term care, hospitals, and so on, that they really do have a lot of good data for us to consider, especially in this kind of one where they would identify, the state would verify, make the lump sum payment, and then the employers would, take that next step. It seemed like a fairly decent kind of an option. Takes a little less burden off of the individuals, some of the issues that were there. Makes use of employer data that they already have, that we would even have to use. I just thought that that was a interesting kind of option. The big thing is, Commissioner, I really appreciate your laying them out the way you have. Just really helpful. That was one of them. Question I have for you, though, Commissioner, is on the Louisiana Frontline program. Do we have, how long have they implemented that? Do we have some results on how did it work? Sometimes a good idea, but then when you go to implement it, it doesn't quite work as well as you would have thought. So do you have any input from Louisiana? I understand we're going to hear more from them, so maybe this is premature, Mr. Chair.
Senator Kiffmeyer, we'll see what Commissioner Doty has to say, but
Yeah.
we will be getting more information
Okay,
from them.
all right, thank you.
Mr. Chair, Senator Kiffmeyer, I don't have information on results, and I'm looking forward to hearing that next week myself. I will tell you that I do understand that Louisiana, like I said, cut it off. They had $250 payments, and they cut it off after the first 200,000 applicants. So if they had many more or whatever, I'm not sure, but I'm really looking forward to hearing what they have to say next week. So.
Senator Kiffmeyer?
Yeah, thank you, Mr. Chair. I'll just wait then to hear more directly there, but I do appreciate all the options and the opportunity to consider them. Thank you.
Senator Murphy?
Thank you, Mr. Chair. And Commissioner Doty, like everyone else, thank you for bringing forward so many options for us to consider with the analysis, probably upper level analysis of the strengths and the weaknesses of each of those. I do want to reflect a little bit on the work during the session on the bill, Senate File 331, House File 41, and the difficulty we heard from employers through the course of, hearing that legislation about the implementation of any means of back pay or hazard pay or bonus pay. And in fact, in some cases where we knew there were federal tax credits available to employers, the employers not choosing to use them because of the administrative burden. So I do want to flag that concern as I look at these proposals, and that experience is suggesting, at least to me, that while there may be some employers that would be interested in this, that universally they may not. And of course, that's a consideration for us as a committee and down the line, but it was a very clear, and unambiguous voice during the session, and want to flag that for the committee. Thank you.
Thank you, Senator Murphy. Thank you, Commissioner, for your presentation, and the committee for conversation. I think we've got a lot to cover today and a lot of testifiers, so I'd like to move. Well, first of all, we have one person who can only testify until 1 o'clock, and it's a bit jumping the line, but I do want to try to accommodate that if possible. So I wonder if, oh boy. Greta, I'm going to ask you to say your own last name. Halupchinsky? Anyway, if you could please identify yourself for the record and proceed with your testimony, we'll make sure to get you in, and then we will move from there to the Children's Cabinet.
Yes, hello, thank you. My name is Greta Halupchinsky, and I want to thank everyone for being here today, and Mr. Chair and committee members for allowing us to speak. I was born in St. Paul, and I have lived and worked here throughout the COVID-19 pandemic. I've been an early educator for about 15 years and spent most of the pandemic working in person in toddler and preschool classrooms. When the pandemic first took hold, early educators were proclaimed to be heroes along with other healthcare professionals and other frontline workers. This was a long overdue recognition of essential professionals in our community, but the hero title without action is an empty accolade. When the pandemic began, we early educators did not have the choice to work remotely as many did. It was scary to be hearing strong messages about social distancing, but still going to work with children too young to have an awareness of their own hygiene. The center I'd been working at for many years closed right away, and I was sent to 4 other centers throughout the pandemic. I was worried about getting sick at work and bringing the virus back to my family. I'm a single parent. I was lucky that my children were old enough to stay at home without an adult during the day, but that meant they were on their own with distance learning, and their education suffered as a result. Many of my colleagues were in similar positions, and some made the choice to leave the field in order to be present for their families. Others, like myself, did not have the option financially to leave the workforce. So working in person during the pandemic affected not only frontline workers, but their families as well. In the classroom, a broken system became amplified. With many teachers quitting, things became harder for those that stayed. Teachers were shuffled around to different classrooms every day, trying to cover teacher vacancies. This made it hard to establish a routine for the kids, which is an important part of a good learning environment. I have always had to purchase materials for my classroom, but this also became worse during the pandemic. Materials like art supplies could no longer be shared between students, so we needed more of everything. And other items like Play-Doh could only be used one time and then discarded. So at the same time I was spending more of my own money, I was not receiving more. Because other areas of my company had closed due to the pandemic, there was not even enough money to allow for our yearly cost of living increase. We did have multiple cases of COVID-19 in the various centers I worked at. Because of HIPAA guidelines, students who tested positive for COVID were not identified. We were informed if we'd been exposed to someone who was known to have tested positive, but we later learned of incidences where children had tested positive and their parents had not reported it to the center. Sometimes a student would be absent for a while and come back, and we were not sure why they'd been absent or if we had been exposed. Being an early educator during the pandemic was physically, financially, and emotionally taxing with lots of mixed feelings. Many of my students' parents were healthcare professionals or other essential workers, and I knew how important it was to provide a safe, loving place for their children while they did their important work. At the same time, I could see how working in person was affecting myself, my family, and my coworkers. Verbal acknowledgement of our field as the backbone of our community was important, but I humbly submit that words are not enough to compensate early educators for their work alongside other essential professionals who kept our communities safe and functioning during the pandemic. Please consider allocating funds for early childhood professionals who worked in person during the pandemic. Thank you.
Thank you, Ms. Holubczynski. Okay, we will now move on to Erin Bailey from the Minnesota Children's Cabinet with her presentation. Executive Director Bailey, please identify yourself for the record and go ahead with your presentation. We are, I think, having some technical challenges. I see that Children's Cabinet is on, but we're not hearing them, and their presentation continues to go in and out. Ms. Hoganson, if you could mute your microphone, please. Thank you. Well, why don't we continue to work on this technical issue, and we will have presentations from people who are in the room and see if we can proceed that way. We can't wait. So let's start with Paula Landis and then go to Kristen Jackwith. Ms. Landis?
Hi, thank you, Representative Winkler. I'm Paula Landis. I work at YWCA Minneapolis. I'm our curriculum director. I'm here representing our early childhood education department. I also run the workforce development program for early childhood education teachers to obtain the credentials they need to take their CDA test. I'm a board member on the Rise Early Learning Center in partnership with Westwood Church, Lutheran Church. So shout out Mr. Winkler to our hometown there. And I also sit on advisory committees for Hennepin Tech and Rasmussen early childhood departments, as well as the Duluth Early Childhood Partnership and the Minnesota Department work group for the CDA expansion into other sectors for educating our new workforce. So I don't have much that I think I need to add beyond what Ms. Greta said. She said it so well about what early childhood teachers have gone through during the pandemic, and I don't think that anyone here disagrees, and we can't enforce it enough. So that was extremely well said, and I just wanted to bring forward what the 300 teachers that I work with, plus all these committees and jobs that I have, all tend to agree on, and that's the importance of the timeliness, which we all echo, and that there's a variety of different ways, and I agree, and we all agree, I think, with those considerations that Commissioner Doty brought forward, is how do we administer it and how do we make sure that it's efficient and timely and really get to the key people that need it. So one thing I would like to bring forward as a possible consideration is to look at the income level thresholds very carefully to make sure that we have enough funds for those individuals that receive the lowest wages. And we know in early childhood, we're the lowest wages of most of our frontline workers. So 50,000 would probably be the max for a family of 4, like 1 adult and 3 dependents. And we could maybe use the free and reduced lunch model for something like that. I think it's really important that we maximize the funds into the pockets of those individuals, especially early childhood teachers that have the lowest incomes to begin with. Any questions for me? Is there more? I'm not really prepared with a whole ton of stuff. I was kind of here trying to be on my good listening behavior. I don't know. I can't agree more, though. I mean, I have a lot of constituents that I speak to just in my work. So if there's any questions or something in particular that we need some feedback on from the groups that I work with, is there something that any of the chair people here have on their minds that they need answered?
Ms. Landis, thank you for your testimony. I think we will try to save questions to the end if we have time. I think it will be challenging today. But I assume that you're available for questions separately if committee members have them.
Yep. Thank you so much, everyone.
Thank you, Ms. Landis. All right. It is my understanding that we are ready to go with the second presentation. So if that is the case, please go ahead, Ms. Bailey.
Thank you so much, Mr. Chair. Can I just confirm you can hear me this time around?
We can hear you.
Wonderful. So good morning, Mr. Chair and members of the working group. My name is Erin Bailey, and I am the Executive Director of the Children's Cabinet. Thank you so much. No idea about our technical challenges there. The Children's Cabinet is housed within Minnesota Management and Budget, and it's an interagency convening that is dedicated to helping make Minnesota the best place for each and every child to grow up. I'm here today as a result of our leadership over the COVID-19 response childcare work group, and to provide an overview of what the state has seen related to the current status of number of licensed childcare providers and COVID impacts on the industry and workforce. I too am incredibly grateful for the opportunity to hear Greta's comments today, and hope that this general overview is helpful. In COVID response, the Children's Cabinet co-led, along with Commissioner Mueller at the Department of Education, the Education and Child Care Work Group. The scope of this interagency work group was to ensure that the care of children did not inhibit critical workers from reporting to work, and to enable continuity of education through distance learning, beginning with early education and childcare. Specifically related to childcare, our strategy was to utilize the existing industry to provide that care for critical sector workers, and then over time continue to leverage that industry, their expertise in the pandemic as the economy reopened, and during that time to provide as many supports as possible to this infrastructure. This was all done in an attempt to partner with childcare providers and with stakeholders who work with them. Childcare remained open in Minnesota. This is different from other states, and we encourage them to do so with these close partnerships, with careful guidance, by working closely to track COVID case data. And in the beginning, providers were asked to serve essential worker families and to prioritize those, and to implement the public health guidance. Next slide. Since the start of the pandemic in Minnesota, childcare providers stepped up to remain open and to serve children. After an initial increase in closures at the beginning of the pandemic, the state's license capacity was estimated to be operating at more than 90% by the fall of 2020. Most states reported that 50 to 75% of their programs closed. And according to federal survey in September 2020, that map is shown here, Minnesota was one of 9 states with less than 25% of programs closed. A brief background of sort of who we're talking about today. As of July 1, 2020, there are 1,814 licensed childcare centers and 6,922 licensed family childcare across the state. Both license openings and closings have slowed for family childcare and childcare licenses during the pandemic compared to the same months in 2019. I'll share some data from DHS licensing on trends in license closures in 2019 compared to 2020 and 2021, and I'll go through the graphs quickly. But in summary, this is what you'll see in the data. The net decrease of family childcare licenses was lower in 2020 compared to the first 11 months of 2019. 2020, there was a net loss of 281 providers, and in 2019, a net loss of 379 providers. The year-over-year trend of decreases in family childcare has not significantly changed since March 2020, and the proportion of providers in the Metro and Greater Minnesota have remained essentially the same every month since month 2020. This trend also shows no impact demonstrated on the proportion of family childcare licenses opened or closed in the Metro versus Greater Minnesota, and no demonstrated change in year-over-year trend of decrease in family childcare providers that has been going on for more than 20 years. Childcare centers have continued to see a slight increase in the number of providers year over year since March 2020. Really, and in summary, we'll be able to see that childcare providers remain open and have continued to serve children. So just quickly, this graph shows that childcare licenses closed for the calendar years of 2019, 2020, and so far in 2021. These are permanent license closures as reported to DHS licensing. You can see the trends are a bit uneven, but overall there has been continued slight increase in the number of childcare centers. The next graph shows family childcare licenses closed for calendar years 2019, 2020, and so far in 2021. Again, these are permanent license closures as reported to DHS licensing. The blue bar is 2019 and the green bar is 2020 and the yellow is 2021. Throughout the pandemic, close agency partners and sharing COVID data related to children has been absolutely critical. Here is updated data on COVID cases related to childcare settings from the Department of Health. In tracking data in earlier iterations of the pandemic, health officials did not see childcare settings as sites of widespread transmission. While there were cases, the majority of time these sites experienced only one case, and few reported 5 or more cases, which we would have signified as an outbreak on site. As you can see in these sort of example peaks, that chart is in the bottom left-hand corner of the slide. And I think this is important to highlight because it is a testament to the hard work of childcare staff of tracking, changing guidance, following guidance closely, changing entire processes of how they did their work from cohorting, screening to testing, et cetera. And I'm going to touch a little bit more on that in a second. I also just want to note before we move on from this slide that it's important to see that, to understand that some of these trends may be changing with increased variant circulation, and the risk of spread in these settings is something that we continue to track really closely. Within the last week, the Department of Health has observed instances in child and youth settings where there is strong evidence of transmission on site. Yet the point really remains the same, that providers were open and followed the public health guidance throughout the pandemic to keep children and families safe. And I'll share some of these examples again. Childcare businesses have always operated on slim margins, even prior to the pandemic. Many of you here are experts on this. COVID mitigation strategies led to increased costs and decreased revenue. Some examples of these changes providers have had to continue to make resulting financial impact include creating smaller and more consistent childcare groups, screening procedures, increased cleaning costs, temporary program or classroom closures due to cases or exposures. And I just want to mention briefly on that point that if we go back to the MDH data slide, that in each of those cases, there is likely a classroom closure for up to 2 weeks or longer, depending on the situation. adaptations to classrooms, spaces, and facilities, including outdoor areas and distance learning support. And a range of research has demonstrated significant increased cost as a result of that. Those items are mentioned on the bottom of the slide. I will not go into detail on this next slide, but wanted to quickly share that Minnesota is one of the few states that provided pandemic-related financial supports for childcare businesses. This started with peacetime emergency childcare grants proposed by the governor and passed by the legislature, and a true thank you to many of the legislators here who we worked in partnership on these with. Then the governor prioritized federal coronavirus relief funds from the CARES Act to create the COVID-19 Public Health Supports Fund. And in March, President Biden signed into law the America Rescue Plan Act, which resulted in Minnesota receiving more than $535 million in childcare stimulus funds, of which $305 million will go out to childcare stabilization grants. The Department of Human Services is currently working in a planning process for the full implementation of these latest grants, which will include base grants to all eligible providers that apply and financial hardship grants that will run through June 2023. 70% of these base grants are required by state law to be used for compensation increases to staff regularly caring for children. The emphasis on compensation increase was in response to a challenge the childcare industry has long faced: low wages and high turnover. The median wage for a childcare worker is $13.57, which is well below the cost of living for a family of 3 and a single person, as you can see on this chart. Preschool teachers and center directors tend to have higher median wages, but still not much above the cost of living. Data shows wages below the basic cost of living for a typical family result in high turnover. The annual turnover rate for childcare services industry is 14.4%, which is nearly double the other sectors listed on the slide and more than 9% economy-wide in Minnesota. I appreciate the opportunity to share some data on the current status of the childcare industry and workforce and the challenges they face both pre and post-COVID. I also want to give a special thank you to our partners at the Department of Health, Department of Human Services, Employment and Economic for their work to compile the data, and a huge gratitude for the work of childcare and early education partners every single day. I'm happy to answer any questions you may have.
That you mentioned, and it is the case that low wages has been a chronic problem for childcare providers across the state of Minnesota. So can you quantify for us potentially what those base grants might mean for increased wages? And can you also talk about the duration of those increased wages for childcare providers or facilities, knowing that this is probably one-time money? Thank you, Mr. Chair.
Ms. Bailey?
Thank you, Mr. Chair and Senator Murphy. I'm going to turn it over to my colleague, Stephanie Hoganson here to provide the detail on the response here.
Ms. Hoganson, we cannot hear you if that is you. Ms. Hoganson, I'm sorry, we're getting a lot of interference, so maybe we can get a promise to answer that question later. Okay, thumbs up from Senator Murphy. Representative New Brindley.
Thank you, Mr. Chair, and thank you, Ms. Bailey, for the presentation. This was helpful. I'm wondering if you can go over the numbers on slide 9 and give us an idea of how those funds were distributed to both home-based and childcare facilities.
Ms. Bailey?
Yes, I can. I need to, thank you, Mr. Chair and Representative Brindley. I need to pull up the specific data. We have provided this, and it might be easier to provide this in writing, the exact numbers per center. I can say just generally, and then if it is okay with you, Mr. Chair, would like to provide in writing the follow-up because we have exact numbers and tracking. But the peacetime emergency grants were a competitive grant process focused on periods of serving critical sector workers. When we moved into the public health supports grants, that was open and available non-competitive process to all licensed childcare, both centers and family childcare. And I believe we've testified in the past and have data really readily available around the number of programs, a very high percentage of programs participated in both of those. And if it's okay with you, Mr. Chair, I would like to provide it in writing so we are crystal clear that I'm right and provide you the right numbers.
Representative New Brindley, will that satisfy you?
Yeah, that's fine. Will you just, thank you, Mr. Chair, and thank you, Ms. Bailey. Can you just make sure we understand in that data when you send that out? I know that I was involved in a lot of discussion in the spring regarding these things. And just exactly what those payments were for the public health support funds, those grants. And then as well as the new childhood or child care stabilization grants, what those amounts are and will be. It looks like it goes through June of 2023. So if we can just get a good understanding of what that will look like, that would be helpful.
Ms. Bailey?
Yeah, Mr. Chair and Representative Brindley, just so I understand to clarify, you're really interested in the total amount
Representative New Brindley.
that went to each program?
Thank you, Mr. Chair and Ms. Bailey. I think that on the slide, we have the total amount involved. I'm interested to know exactly how those funds were distributed to individual providers and the amounts that individual providers were receiving and will be receiving every month.
Ms. Bailey.
Mr. Chair and Representative Brindley, understood, and that has varied throughout the strategy of the funding source, and I will get you very clear written update with our partners from Department of Human Services on what that will look like, especially around the new stabilization grants that we're moving into now.
Thank you. Senator Kiffmeyer.
Thank you, Mr. Chair. I appreciate hearing today from Ms. Bailey and from Ms. Hoganson. Having spent 2 years on the Family Child Care Task Force, we spent many, many hours together, whether it was by Zoom or in person as we were able to do so. So it was great. It's good to see you too again. In regards to this, I think I would agree that we need to have information because there's a statement here, 70% of base grants required by state law to be used for staff compensation. In home-based family child care, there is one person taking care, sometimes two. So I think it's really important that we clarify that by having the dollar amounts that went to home-based and dollar amount that went to centers, and then the number of centers and the number of home-based. So we just get a little bit broader idea of the impact. But I've added it up, that's $545 million between 20 and 23 that goes to this particular area. And I just think that's something to be of note. But some of those were specified in federal, the CCDBG funds, and some of those were specifically specified in that direction. So it wasn't, it was required by us to do so. I appreciate all the information again, but I would add also to having a little more data. Thank you.
Representative Frazier.
Director Bailey, thank you again for providing this information. Maybe not so much a question, but an observation. You pointed out the fact that there were maybe not substantial outbreaks. It means our child care workers did a great job of making sure things, following the guidelines and taking care of our children, of our essential workers. But I want to make this point, and I think I've been making this point throughout. We have to look at the interconnectedness of this all. Without our child care workers being there to provide those services, many of our essential workers would not have been able to work. Although there may not have been substantial outbreaks, although there may have been resources put to raise already very low wages, we still have to make sure that we consider the fact that those child care workers, day in and day out, were in harm's way and continue to show up to do the work that allowed for the rest of our essential workers to do their job, which allowed for the state of Minnesota to continue moving along as we dealt with this pandemic. Just wanted to add that, Chair.
Director Bailey, any final comment?
No, Mr. Chair and Representative Frazier, I appreciate the comments. I know that Stephanie was able to call in and she can speak to a few of those questions briefly if you wanted to loop back on that, Mr. Chair.
Senator Murphy.
Thank you, Mr. Chair and Director Bailey. And I think, happy to get the information that I'd asked for in writing. As I look at the list of testifiers today, there are many child care providers probably working not just in child care centers and family care centers, but also that people that didn't necessarily do child care who became child care providers in the height of the pandemic. And I'd really like to hear those voices as well. So if it's okay with Director Bailey and Ms. Hoganson, I'd love to get the answers to the questions that I asked in writing so we can hear from the people who are here to testify as well.
Good suggestion, Senator Murphy. Thank you. Thank you, Ms. Bailey and Ms. Hoganson. We will circle back and get those answers in writing and continue to ask follow-up questions as they arise. So first of all, I want to make sure that the people who are here in the room have a chance to testify. So do we have Kristen Jackwith? Okay, why don't you come forward and present your testimony.
Thank you, Mr. Chair and members of the committee. My name is Kristen Jakewith. I operate 2 child care centers in Litchfield and Wilmer. I actually traveled about 2 hours today to speak to you. To say the impact of COVID has been a hardship on our child care and early educators is an understatement. Our centers have faced multiple quarantines and closures, and my staff have multiple times had to quarantine and miss 14 plus days of work at a time. This puts a huge financial hardship on them. Not only the stress of working during this uncertain time, but going home and taking care of their families has weighed heavy on many of them. The stress in our field of keeping our doors open, keeping the children safe and healthy, and following all the protocols and quarantine procedures have caused many of us to have PTSD-related issues. We haven't slept. We cringe when our phones ping. Our staff had to become overnight elementary school teachers. Just an example, my school-age teachers have had to have 20 plus pages of notes to get through one school day. When you imagine a classroom of 15 students with 15 different classrooms, 15 different Zoom calls all day long, it became overwhelming. Without hesitation, however, we answered the governor's call and remained open so that essential workers could go be on the job. There is no social distancing in our work. We work close contact with children for 10 plus hours a day. You feed them, you dress them, clean them, rock them, hug them. This is how you care for young children, and there is no substitute for that. In a field that's already underpaid and underrespected for what we do outside of the pandemic, let alone during one, the increased personal health risk to our staff and their families. Early care and learning is the lowest paid occupation of any, requiring a high school diploma and further education. We need to reward and retain these educators that have served this whole time, especially since our industry is suffering in attracting and retaining staff. The entire population we serve is unvaccinated due to their age. We're caring for a population 100% vulnerable to contracting COVID, and this puts us at a higher risk even if we are vaccinated. We do not have the luxury of working from home or social distancing ourselves, and our educators stepped up for the call for action and remained steady. To give our childcare providers and teachers some sort of bonus from the Frontline Worker Fund could never truly repay them for their service, but it would be a tangible recognition of their contribution to our communities and children we serve. Thank you.
Thank you, Ms. Jakewith. Questions from the committee? Senator Murphy.
Thank you, Mr. Chair. And Ms. Jakewith, I don't have a question for you, but I want to say that I am the mother of twins and remember when my 2 were home and I was home, and the thought of that experience that you just described is a sharp and beautiful but difficult memory, and I just want to make sure I say thank you to you.
Thank you, Senator Murphy. Thank you, Ms. Jakewith. Thank you for traveling to share that with us
Thank you.
and for the work you've done. Next is Molly Miller in person. Why don't you please come up?
Hi.
Hi, just
Good
please state your
afternoon, Mr.
name.
Chair and members of the working group. Is it okay if I take this off? feel like, making sure. Oh. My name is Molly Miller. Sorry, I was kind of like zoning out. Everybody's been saying exactly what I want to say up here. I'm representing a different group. However, my name, I have a general and special ed para for elementary schools, actually here in Maplewood and Roseville. I'm currently a behavior team member at the middle school, so you can imagine how that is, for ISD 623 right up here. I'm also a member of AFSCME Council 5, an executive board committee member of the local 1129, which is who I'm here to testify on behalf of. Thank you very much for getting my testimony today. I'm here to ask for your recommendation for us to be part of that K-12 hourly workers group who did daycare from day one of COVID-19. As you are well aware, we were charged with delivering free food right away in 2019, and we have been working with kids officially and non-officially ever since. We love to keep those, and it's important to keep those relationships with the kids, to keep them engaged, to make sure that they are being connected with every single day. And that's just who we are, because we love kids and we love everyone's kids who come, their family to us. So it's very important for us to be connected all the time. However, during the pandemic, I wanted to put a face to the name of some of the thousands of paras and clerical workers and school workers and bus drivers and cafeteria workers and other school workers that took care of the kids of these essential frontline workers. We had kids of doctors and nurses, and it was so important for them to be at school because they needed to be there taking care of our family members and your family members and everyone. And these were dangerous tasks. And it was us. There's thousands of us. In fact, I just came from there right now. During the fear and confusion at the beginning, as you've been hearing a lot of today, I really appreciate Greta and the young lady that was up here because they are bringing forward people who are not used to taking care of children, being thrown into all of a sudden become elementary school teachers or middle school teachers. We felt very underprepared. So many of our questions cannot be answered before we needed to show up and do our jobs. Many of us had only worked with a few kids. 1 to 5 kids, small groups is normally what they're trained for, or in the case of some clerical workers, they had never worked with kids. And we had no plans or procedures or processes to safely handle kids for 8 hours a day, 5 days a week. And when we showed up, we were alone with up to 15 kids per classroom. I myself had a roster of 15 second graders, and I'm glad that I was a coach, and I'm glad that I worked in elementary for a long time, and I have the different background that I have. I work in the schools because I'm a single mom, and I wanted to be on the same schedule as my kids. But I was also the union rep for our area, so people were coming to me in tears with fear and concern in their eyes. I don't know how to handle, I'm a librarian, I don't know how to handle 12 sixth graders who are mouthing off to me and not doing what I tell them to. They won't stay away from each other, they won't keep their masks up, that kind of thing. So I really feel for them, and I'm really here for them today because they very rarely will speak up because they're doing their job and they find a way. They're problem solvers, and they love our kids, so it's a good thing. I do want to point out that we're taking care of up to 15 kids, and we had no idea if they had behavior, BIPS was what we call them, intervention. We didn't know if they had IEP, special ed conditions or needs, and we were in charge of them for 8 hours a day. And although I thrive on that, not very many people do, and that's a very scary situation if you've never been around a child with autism, and all of a sudden you're in a classroom, you don't know what you're doing, you have no plans, no procedures, no supplies, and all of a sudden he's throwing things across the room. Or it's just a dangerous situation for a lot of other kids too, because they don't know, and we don't have the processes for that. But we did, and we did it well, and we, if we were gonna miss a day, it was up to us to find our own subs, because technically we weren't from the district. They were just providing workers to the daycares that happened to be in the schools. We brought our own supplies, as you've already heard, and teachers usually do, but we're paras. And we dug in and did research and provided curriculum for these kids because they are children, just like everyone else's children, and they needed to be engaged. They needed to be kept safe emotionally because they didn't know what was going on. You know, little kids coming up to me, why can't I sit on your lap? I need to be able to be close to you. I hurt myself. I have a boo-boo, you know, and you have to say, I'm sorry, you have to be back. Here's what we need to do. Go wash your face, put your mask up, you know, 5,000 times a day. The people with the lowest paying jobs in the district had daily high-risk face-to-face contact inside one classroom with multiple kids from high-risk frontline doctors, workers of COVID units, grocery store workers, well, all of your constituents. And it was important to us and it was important to them, even though we had this fear. We kept them all safe. We kept them all happy. We did keep them all engaged, and we did continue teaching them and having them learn and get further in their education. We did this with limited job security, especially at the beginning. We had to use our own sick time at the beginning, like right when it started. And if you're quarantined, that's it. That's all your sick time. And if you get sick after that, it's on you. So it was very difficult, and I just really, I don't know after we were charged with this job if we were a second thought, because we were doing it. And I just really wanted to bring us to the forefront for you that we really did, you know, we missed out on being able to take other jobs, or we missed out on being able to be I have a neighbor who's a doctor. She's like, can you take care of my kids? I'm like, I can't. I've got to keep my job because I will lose it if I don't show up. And we're very thankful for the CARES Act when it came. And so that was a good thing, but it wasn't there right away either. And I was actually sick with COVID when COVID started. And so I was a long hauler, and I was really run down until I could get my shots, which thank goodness worked. But, you know, we're not done. I just came from school. Out of school care is still working. We still work with kids. I worked for summer school. I coach basketball, so we had extra boys basketball chat room for social emotional and make sure they were keeping their grades up. And I did, you know, drive by in their houses if they weren't getting online and stood outside with my mask, my arms crossed. But we're out here, and there's a lot of us, and we've been doing our job, and I would really appreciate if we were recognized for those things. Thank you so much, Mr. Chair.
Thank you, Ms. Miller. Senator Murphy?
Thank you, Mr. Chair. And I know we're pressed for time, so just 2 questions, if you will. Thank you. Thank you for being here. I have a specific question about sick time.
Yeah.
And a more general question about the mechanics of how did you get your assignment? And how did the kids come to you? I've heard so many stories about people taking on the responsibility of childcare so essential workers could go to work, but I don't understand how you got there and how the kids got there, and how that pairing happened.
Sure.
Ms. Miller?
Thank you, Mr. Chair. We got emails from that first spring break in March of 2019. We started getting emails about, we're going to need you to show up. We're going to need you to show up. And we started doing meals almost immediately. And we were continuing on the bus routes, things like that. I know that people are like, oh, the pairs are underappreciated, but really, we have the closest relationships with these kids. And so they connect with us sometimes all summer, especially if we have kids of our own. I have 2 boys that are younger, and they were alone this whole time. But they're friends. I mean, I had to turn my phone off because I was like, hey, Miss Molly, can you do this? Hey, Miss Molly, I need this. And, oh, you know, my grandma died, or we have, you know, it's been a very difficult time. But kids find ways, especially if you're a coach, or if we kept our school emails open all the time. A lot of us kept chat rooms open all through the summer because it was a scary time. And we just tried to keep those connections going because we knew that if we weren't going to go back to school, we didn't know, we wanted them to be engaged. So we wanted really to solidify those relationships with those families because we're a team. We needed to work together with them. So that's how. But we get mostly through emails and Zooms.
Senator Murphy?
Thank
Mr. Chair.
Mr. Chair.
Thank you very much, Ms. Miller. When you had to use your sick time to quarantine, who decided, I don't know who your employer is for sure, so who decided that you had to use your sick time instead of saying, under these extraordinary circumstances, we're going to make sure that we're covering your sick time, so you
Right,
don't have
before
to
the
use your
CARES Act.
bank.
Ms.
Okay,
Miller?
thank you, Mr. Chair. Yes, I just wanted to be clear, thank you. At the very beginning, before things were in place, I know March of 2020 was when the CARES Act came out, but right away, I think it was just because we didn't really understand who we were working for at the beginning. We were told from our district where we needed to be, and we would show up, but if we're like, we can't, they're like, well, then you're not working today. And so you need to use your, if you want to get paid for today, you use your sick time, because you're not available for what we need you to do. So a lot of, like the teachers were able to do it from home. Even if they were sick, a lot of times you can still do it from home, but we were having to go places and do things and be face-to-face. So we needed to use, if we weren't available for those things, we had to use our sick time until CARES started.
Thank you. And I have Letha Falls and Judy Jackson. I know that you're here to, can you stay until 2 so that we can keep going on the childcare theme and get to you? Is that okay? Otherwise, if you need to leave, we'll take you right away. Okay, thank you.
Thank you so much.
All right, next, I'm going to go to Aaron Wollabaugh because he needs to leave before 1:30 or be done by 1:30. Mr. Wollabaugh?
Thank you very much for giving me this opportunity. I'd like to say, Chair Chris and members of the committee, my name is Aaron Waluba, and I have worked as a restorative practice specialist for the Brooklyn Center Community School for 3 years. I'm also a member of the bargaining team for my union SEIU Local 284. It is critical that everyone who show up to work in person during the COVID-19 pandemic be included in the definition of frontline workers. At the beginning of the pandemic, stores limited how much meat, toilet papers, and other provisions we were allowed to buy. It wasn't always enough for my family, thanks to the meat packers and other essential workers. Those restrictions were quickly lifted, and my family was able to get what we needed. Personally, the stimulus check was the only direct help I got during the pandemic. It helped me care for my family and made a big difference, but that's the same amount of money that everyone got, including business owners, including business owners, and that was the only amount I got, including business owners, people who work remotely, and people on unemployment. Frontline workers deserve hero pay because we put ourselves and our family health on the line in order to support our community. When administrator, teachers, and other staff members were working from home, school support staff were the ones coming to work in person to engage with students. We gave them materials, we made sure they were on track to learn virtually and felt supported during such an uncertain time. I'm really proud of the work we were able to do during COVID at my community school. We built relationships with the students and their families, who were the ones students look up to. I was able to be there to help our students through this time. I heard many heartbreaking stories about how COVID impacted their families and how heavy that weighed on so many of our kids. We were there to give them emotional support and tools and resources they needed to help them stay on track with their academics. We were the liaison between families, students, and teachers. And during COVID, we were the bridge that kept them connected. We made sure students had everything they needed to do so that they could help learning, and so they knew that no matter what, they were not alone. The big blue barn at our school is always a hub for community activities. It was the place that our families came to support one another through the pandemic. After the fatal police killing of Dalton Wright, the Blue Band was the place our community came together to grieve and support one another. My colleagues and I organized a restorative vigil that offers support to our community, to our students and families, and gave our students the opportunity to hear from city leaders. I was proud that many of our young people spoke so powerfully to our city leaders about their fear and their hope for the future. The work we do is important. We are told we are essential. Yes, we are. But our pay doesn't reflect the value of our work. Many of us need to work 2 and 3 jobs because our pay and benefits are not enough to support our families. That's especially challenging in the summer when our hourly workers don't get paid and are not eligible for unemployment insurance. Members of this working group, I encourage you to take this opportunity to show that you value our contribution by providing school staff and all essential workers with meaningful hero pay. I thank you, Chair Winkler, and the rest of the members of the committee. Thank you very much.
Thank you, Mr. Wollaba. I do see that Commissioner Grove and Senator Kiffmeyer have hands up. I'm sure it's to an earlier testifier, but I just wanted to get to this one so we can meet the 1:30 deadline. Commissioner Grove.
Thanks, Mr. Chair. Mr. Wollaba, thanks for your testimony. You are a hero. Your industry is heroes. I just wanted to take a moment on behalf of the administration to thank all the child care workers out there. There's a reason Minnesota was voted the #1 state in the country for children throughout this pandemic, and it's thanks to the hard work of all of you. I know we worked tirelessly to try to match up child care providers with slots that were open through an interactive map and a bunch of other technology we put on our platforms that the Children's Cabinet led on, and those grant programs helped too. But you're right, the market is broken on this, and I'll just add that when we're out talking to employers every day, every week right now, the #1 concern they raise to us is the lack of childcare, and our state is driven by some of the dynamics that Mr. Wollaba just went through. So not only are your sacrifices appreciated during the pandemic, but we know that moving forward in our recovery, they're going to be critical too. So I just wanted to thank you for that and share that thought with the committee.
Thank you, Commissioner. Senator Kiffmeyer?
Thank you, Mr. Chair. This is just a process question. I so look forward to all of these testifiers right now, but I look at the time that we have left, and seriously, I have another commitment, and so I really want to hear them all. I'd rather hear even a little bit from them, even if it's maybe not their entirety, but I'd sure like to hear from them all. I'm not quite sure how we could do that with the time we have left.
Senator Kiffmeyer, I think it is a challenge. We have taken the approach of anybody who has signed up to testify, we're going to try to fit them in. If members of the committee need to leave at 2, of course, that's understandable, and we can try to wrap up and ask if some others can come back at another time or ask to submit written testimony. But it is a challenge. There are so many people who have, I think, understandably want to be on the record and make sure that we hear from them. So we're going to try to move through as much as we can.
For sure. Thank you.
Okay. I have Ann Arney and Rachel Bartzak. Ms. Arney?
Hi. Yes, thank you so much. Ann Arney here.
Please go ahead.
Hi, my name is Ann Arney. I am a level 3 special ed para for Stillwater Schools. I have a teaching license, a master's degree, and more than 15 years of experience, but nothing could have prepared me for what these past couple school years have been brought to us. Being an education support professional has by far been the most rewarding of any position I have held throughout my career. In March of 2020, when school first went online, I was relieved. I was proud of our state for taking swift action to protect our youngest community members, but soon my relief turned to fear as I realized I was about to be thrust into the trenches of a deadly pandemic and putting myself and my family at risk. When classrooms moved online, I assumed that as classroom support staff, I too would be online. My students were online, my case manager, all of my students' teachers were online, but instead I and my colleagues were not given that option. We were informed that our jobs would shift from education support to emergency childcare. We had to start immediately in person. and we'd be caring for the children of frontline workers. At that time, we had very little knowledge of COVID. We had not been provided with any PPE, masks were not being widely recommended or used. We were disinfecting every surface multiple times a day and being told to stay 6 feet from the children that we were supposed to care for. But how do you stay 6 feet from a scared child and refuse to give them comfort and care? Paraprofessionals were given the difficult choice to either work in person, performing duties outside of our job description in unknown conditions with the highest risk of exposure, or find a new job. And so with zero medical training or equipment, I went to work. I walked into a space that was not in my contracted building with students that I did not know, whose grown-ups were going to work as doctors and nurses and first responders, students who were sharing households with people that were being exposed to COVID on a daily basis and then bringing that exposure to me. My colleagues and I had high hopes for the 2020 school year, but we realized quickly that there would still be no option to safely work from home. Again, our duties were reassigned and level 3 special education was not going to be online. The student population that I and my colleagues support are the highest need, highest risk, and most vulnerable. Academic support is only the tip of the iceberg. Mental health, self-care, social emotional practices are woven into the fabric of our daily tasks. There is no social distancing, and there is no consistent masking with these students. There is hand-over-hand instruction. There's bathrooming that includes diapering and wiping and washing. There's mobility support that requires face-to-face lifting and transports. There's feeding that includes wiping mouths, choking prevention, and there is nothing but close contact for 6 to 8 hours per day, and no way to prevent body fluids from being transferred from our students to ourselves. I lost count of the number of colleagues and students I work with who contracted COVID. Even more were quarantined, and often more than once. After 10 days, which generally covered 1 quarantine, we were not given any additional paid leave, and many of my colleagues were forced to take unpaid time off in order to fulfill a state-mandated safety protocol. And when I say unpaid, I mean truly unpaid, because ESPs don't even qualify for unemployment. We pivoted daily as guidance changed again and again. We bent over backwards to protect not just ourselves, but the most vulnerable and most at risk within our schools. When my own child was sent home for distance learning, I was again faced with a choice. I could either go to work, risk my family's safety, and leave my own child unsupported, or quit. I requested an online position, but it was denied. I ended up taking a 7-week leave of absence, at the end of which I actually owed money to my school district and had to pay in order to keep health insurance for my family during a deadly pandemic. Let me be clear that at an average of $14 per hour, ESPs are some of the lowest paid workers in education, yet our role has been deemed so critical to the success of a school environment that the only choice we are given is to work in person. When I returned to work, I was so incredibly grateful for the opportunity to be vaccinated. The fact that school employees were deemed both important enough and high enough risk to be given that special vaccination status is proof that we are on the front lines. As we prepare for the school year, one yet again fraught with uncertainty and questions, I ask you all to consider who it is that is making it possible for our children to be in school. Who continues to show up for our communities and for your kids? Frontline workers are not just medical staff. We're educators, custodians, food services. We're scared, we're exposed, and we're the ones propping up the communities and economies, providing a safe space for everyone's children so that everyone can go to work. We're essential, and we are the way forward, and we are proudly and bravely in your service. Thank you very much.
Thank you, Ms. Arney. Next, I have Rachel Bartstack.
Hello, I'm Rachel Guttenay. Thank you so much for having me today. Before I give my testimony that I have written, when I was listening to Molly Miller talk, it was amazing to me how much that sounded exactly like our district. And it was kind of during that testimony, I realized that this is an all over state issue. It's not just a Cloquet, Minnesota or Duluth, Minnesota. It's not just one school. We're all going through the same issues. And that was really emotional for me to hear. So thank you for that. Thank you, Mr. Chair and members of the committee. My husband and I, along with our 5 collective children, live in Cloquet, Minnesota. I'm a member of AFSCME Council 65, Local 545. For the last 6 years as a paraprofessional, I worked with students with severe developmental and cognitively delayed students. Basically, I provide care to students who typically cannot function without having one-to-one care all day. Most of the kids I work with have no or very little communication or verbal skills. A lot of them wear diapers, and some of them require more medical type care for seizures and feeding tubes. These students require constant hands-on supervision. It's not for everyone, but to me, it's a job that I love going to day after day. I have 3 other jobs through the district. One is teaching an after-school enrichment program. One is teaching or assisting with the community education adult with disabilities program. And in the summers, I assist with summer school. I've done the after-school program and summer school for approximately 5 years and the adults with disabilities program for approximately 15 years. When COVID-19 shut down Minnesota schools, it shut down 2 of my 3 jobs. Our after-school clubs and our adults with disabilities programs were closed by the pandemic. In my remaining job as a paraprofessional, we were given many tasks, not part of our regular duties, and we stepped up. Without any extra compensation, we were instructed to provide childcare for 8 to 10 students per paraprofessional during what would have been normal school hours, putting us at added risk of exposure to the virus. My coworkers and I provided emergency daycare at a time that very little was known about COVID-19. We would constantly stress, wondering if the students could possibly be giving us COVID-19 without us even knowing it. And when we were home with our own children, we worried that we unknowingly brought it home to our families that day. Tests were hard to come by and we risked exposure every day. We had to trust that all the people in our community were following the safety guidelines so that we, our families, and our coworkers get sick or even worse, die. Our days were filled with stress, worry, and more stress while having to stay calm in front of all the kids in our lives so they would not be alarmed or panic themselves. I'm extremely proud of the work our staff did to keep rolling with the punches and providing the best care we could to our students with the little resources we had at the time. Also, it was during this time that our job duties changed dramatically. Instead of showing up and doing a job we all knew well, we were literally divided into separate classrooms, given the bare minimum of supplies, and put in charge of 8 to 10 kids that most of us had never met before. We ordered activities off Amazon to occupy their time, but as we all know, deliveries were behind. Many of us brought board games, puzzles, etc. from home to have to play with the kids, but they couldn't even play the games or do puzzles with kids because they needed to stay 6 feet apart. Kids quickly got bored and tired and then had pretty bad attitudes. We struggled with our own mental health, and it was apparent that the kids we were working with were struggling with the same. I'd also like to point out that during our first shutdown as paras, our principal and our social worker were the only staff in the building. Our teachers then at that time had the option to stay home, and all but a few of them in our building chose to stay home. If they did come in, it was in the evening, so they wouldn't get exposed to the kids that we as paras were with all day long. Had we chosen to stay home, the kids wouldn't have been able to come, which means their parents, who were doctors, nurses, and other essential workers, would not have had childcare for their children and would not have been able to provide their essential services. We became the most valuable employees in the district. When schools returned to in-person or hybrid learning, our work remained supporting our students hands-on, continuing to put us at high risk for exposure. We will be at high risk until the pandemic is over. I applied COVID-19 unemployment because, as I understood it, I should qualify since I lost 2 of my jobs as a direct result of COVID-19. I quickly found out that this was not the case. I was sent denial letters, but not given a reason why. I applied more than once since that's what the unemployment website instructed me to do so, but each time I was denied. However, had my second and third jobs been with, say, Walmart or Target, I would have qualified for unemployment when they were cut, including the COVID-19 benefits. During all of this, while we were stepping up for our communities, I was dealing with the stress of losing a large part of my family's income. I was down $500 a month. My 2020 W-2 showed a decrease of almost $5,000 from the year before. The loss of that income continues to put more stress on myself and my family during an already stressful time. I love the work I do. However, we, like many frontline workers, need some support or we will burn out. This is a start, but it's not enough. We need your help to keep doing the work that we love. Thank you.
Thank you. I have two different last names for you from my list versus what's on your screen, so could you just clarify for us your first and last name?
Sure, it is Rachel Godney. It's what appears on the screen.
Okay, thank you, Ms. Godney.
Hi,
Thank you.
Ryan. Chair Ryan.
Yeah,
This is Michelle Goodwin. I actually have a parent who is on this list who has been here with us, and I'm wondering if by chance Lena would have a chance to talk before she needs to leave.
so Ms. Goodwin, who is the testifier?
Selena Brers. She's right below my
Number
name.
16.
Yes.
Yes, Ms. Good, so I see that you're on the list as well. Is this covering your testimony as well?
It can be, yes.
Okay, please go ahead. Please identify yourself for the record and proceed.
Hi, my name is Selena Bars, and sorry, it was echoing. Hi. So I just want to give a short testimony. My children attend the Child Care New Horizon Academy. I have currently 3 children that attend the program. I have 4. So I just want to start off by saying that the pandemic was really hard on my family. My husband was a behavior specialist with the St. Paul Public Schools. So his job was actually put on hold for quite some time. And so like I was the only one working at the time, but also with being pregnant. So it was just a lot of stress that it took on my family, but I was really appreciative of New Horizon being able to still be open and provide the childcare for our smaller children, especially because they were missing out on the social development and the learning and just the interactions of being around other children. So sorry, I might get a little emotional. My husband just passed recently, so it took a toll on my family. And I was just really appreciative that New Horizon was able to still be here as I grieve him as well, and still be able to be supportive of my children and being able to allow them to still attend as I was able to grieve his passing as well. I do want to just say thank you to the childcare workers and the school districts for being able to provide that opportunity still for children to still be able to attend and still be able to be here and put their lives and then their own personal lives in jeopardy during this pandemic for all of the children, especially being so small, and seeing that the children needed to be around other children and being able to have that opportunity. I do want to say thank you to them for that.
Thank you. Very sorry to hear about the loss of your husband. Thank you for your testimony. The next person I have.
Sorry, and that's all. It just being that the pandemic just took a toll on everyone's situation. Like I said, my husband had to get laid off from his position and in the school district, and being able to figure out our financial problems and still being able to support our family, being pregnant with COVID, and just being able to have that opportunity is really a blessing. And I just wanted to share my testimony. Thank you, guys.
Thank you so much. Next on our list, I have Maria Cruz, followed by Judy Baumchill. Ms. Cruz, please go ahead.
Thank you. Thank you, Chair Winkler. I'm sorry, my first language is Spanish. So they invite me to come and give my testimony, and I'm thankful to be here. I'm gonna read it because, as I told you, my English is like my second language. Thank you, Chair Winkler and members of the work group. My name is Maria Cruz, and I'm a Spanish immersion paraprofessional in Rochester Public Schools. I am one of the thousands of education support professionals who has been working in person through this pandemic. Last March, I wasn't given an option to work from home or not. Our education support professionals were needed to help our teachers get materials together and deliver food and technology to students and their families. Also, we work for emergency childcare. Then, as distance learning began, we were asked to help support students using that technology. These were things I didn't know a lot about, so I had to learn first before I could teach anyone else. I had to learn so many new things, which was great because I was able to learn a lot, but it was stressful. We didn't have any training, and we were expected to do everything. I was so stressed and then worried that my students will feel that I love my work, I love my job, I love being around kids and helping them as much as I can, but there was some things we could not during this pandemic. If kids need a hug, you can't. It was hard. I work with kindergarten kids, so it's hard when they, with all the stress, and we cannot even give them a hug. You can. So it was hard working in those moments. We did more jobs than we did before because the teachers were balancing so much and they needed our help. I also have 4 of my children living with me who were doing their school. So I was balancing work and helping students all day and helping my own children learn too. So many other ASPS were doing the same thing as me, working in person, doing new work and learning new things. So we could support our students and families all without training and any additional pay. Even before the virus, ESPS like me weren't getting the pay or respect we deserve for the work we do. I often get asked about open positions in our school. Like right now, we have many positions in the Spanish immersion program, but then they ask how much money it pays, and it's not enough for them. So they say, I cannot apply for that job because I don't gonna have enough money. I need to pay my bills. So it's hard to hire or find people that want to work as a paraprofessional. And we don't have enough staff right now. I do this work and I love this work, but I still may need to leave my job if my family needs me to make more money for what we need. I also know I'm lucky to have had access to live and support the principal. So he thinks family came first, but sometimes we don't have a choice. Sometimes we decide to take care of family or make money. My family tests positive for COVID. I'm sorry. I'm kind of emotional person. So in January, so we don't know where we got it, but I was able to receive time off. So I appreciate that, but the district only paid like 10 days. So I get more than those days because all my children and my husband and I get positive. Other ESPS in other districts were as lucky and went without pay. So I also lost family members during COVID. So I'm just grateful that I'm still here, but we did so much. And now I ask you to consider ESPS for this additional money. We did much for our students and we deserve it. As I love my job, and at some point I really need another job for keep supporting financial my family. I don't want to leave this job, but that is my testimony, and thank you so much. And I'm sorry for the emotions right here. Thank you for making me part of this.
Thank you, Ms. Cruz. All right, so before 2, I'd like to try to get the 2 testifiers who are remaining here in person. It's not on the topic of childcare, I don't think, but if you could please come forward. I have Letha Falls and Judy Jackson. Please state your name for the record and proceed.
I'm Letha Falls. Chairman Winkler, Senators, Representatives, and Commissioners, thanks for allowing me to testify today. I am a proud member of the ATU Local 1005, and I have worked for Metro Transit for 21 years, first as a bus operator and currently as a maintenance facility worker. I am here today to ask you to ensure all frontline workers that their fair share of the $250 million at your disposal and include the transit professionals in that equation. $250 million, that's a hard number for me to imagine. In fact, while we went through what the rest of the Twin Cities did, the pandemic, the shelter schools, and the civil unrest, we were also working without a contract. In fact, our employer took advantage of the situation to make it as difficult as possible to negotiate with them. I work in a maintenance facility. I clean buses, trains, and platforms. How did COVID affect me? Well, remember all of the extra cleaning and sanitation that went on to try to disinfect transit vehicles? That was us. And for a long time, we did it without proper PPE. Remember all the talk about social distancing? We can't distance yourself from a virus-filled bus when your job is to fix it. Remember all the talk about working from home when nobody in our rail maintenance has train tracks coming out of their houses. The risk of COVID added to our already dangerous and taxing work. On a regular basis, I clean up and dispose of syringes, bodily fluids, and am faced with threats of assault every day. Just last week, I intervened in an assault and attempted robbery at the Target Field station. Me and my coworkers stared COVID in the face and still went in every day. When called, we served. When asked, we sacrificed. Many of us dearly. We've gotten sick. We've brought it home to our families. One of my coworkers got infected with COVID while cleaning a facility, transmitted it to his family and his elderly father. Sadly, his father passed away from COVID, and the rest of the family members are still having a hard time recovering. Across the country, hundreds of transit workers died in this job. Those of us still here left wondering whether anyone cared and why we should do it again when the next wave comes. We transport these doctors, nurses, grocery store workers, mail carriers, and other essential frontline workers. We've been called heroes, but we've been treated as anything as such. And we are starting to lose faith. I urge you to restore our faith again, to show us that when the state of Minnesota says we're heroes, it means us. Please make sure that this money is allocated into the hands of those of us who are risking the most in this pandemic. Thank you, Chair.
Thank you, Ms. Falls. Ms. Jackson?
Hello, Committee Chairman Winkler, Senators, Representatives, and Commissioners. My name is Judith Jackson. I'm also a proud member of the ATU 1005. I'm a bus operator for the last 19 years. You know, despite all the hype about frontline heroes, all of us, transit workers, teachers, service workers, public service, have been treated or have felt that we haven't been underappreciated. Like Letha said, there are no train tracks coming from people's homes. You can't drive a bus from home. You can't use Zoom to transport people from their jobs. You can't get dialysis or anything like that on FaceTime. It turns out that transit is essential to our society. For many people, Metro Transit offers safe passage in hard times. We take tired people home between shifts. We take the less fortunate to places to cool down or warm up to get a meal. And we take huddled masses everywhere they need to go. In these difficult times, it's been hard on all of us. We do it every single day, even when we don't want to do it. We do it knowing that every time we open that bus to the door, there's a good chance that we're letting COVID on the bus with us. In fact, one day I did it, and a friend of one of my children got on the bus. And I was so happy to see her because I hadn't seen her in a while. I said, "Oh, hi, honey, how are you?" And the first thing she said was, "Could you pray for me?" And I looked at her and I said, "Pray for you?" She says, "I'm sick." I said, you have COVID?" She said, "Yeah." "What do? You tell her to get off the bus? You can't do that." I live in a multi-generational home. Excuse me, where my mom lives with me, who had just gotten her second diagnosis of cancer. So imagine knowing that her immune system was compromised. When we didn't know if this stuff was on our uniforms when we got home, it was just hard. And when she asked me to pray for her, I prayed for her. I prayed for her and me and all of us out here. We do this job every day knowing that the air circulation on the buses blasts viral particles in our face for 8, 9, and 10 hours a day. We did it when we didn't have the proper PPE. We did it when we didn't want to. We did it when we knew our coworkers were getting sick and that the news was saying that transit workers were dying. We did it. We did it because we're proud of the work we do and the value it creates and the service it provides for our communities. We didn't do it for the money. We did it because that's our job. And we knew people needed to get where they needed to go. I did it. I did it with a grandson at home. I did it with a son that had COVID twice. We just have to do it because that's the job we signed up for. And I want to thank you guys for your time and consider that all frontline workers get their fair share of what's needed. Thank you.
Thank you, Ms. Jackson, and to you, Ms. Falls, for your service to the public and for your powerful testimony today. Okay, so we are over our time. There are 13 testifiers still on the list. I guess I understand that members of the working group have to leave because of scheduling conflicts and so forth. And there are just so many people who I think have important things to say. So my intention is to stay as long as people, well, I can stay for 30 more minutes. And so I would ask the testifiers who are left on Zoom to try to keep your testimony to 2 minutes so we can try to get through it in the next 25 minutes or so. Next up, I have Judy Bombchell.
Thank you, Chair Winkle. Thank you, Chair Winkler, and members of the work group. My name is Judy Bombchell, and I've been an education assistant with the Robbinsdale School District for 30 years. I love supporting are children in small groups throughout the day who may need extra help in reading and math or the opportunity for more challenging work. I also love being able to supervise breakfast and lunch and help make sure our students get on their buses and to their parent pickup cars. Whether in a small group or in the loud lunchroom, my students know that I am there, a caring adult who wants to see them succeed inside and outside of school. That core value is why I'm here today. ESPs were on the front line of this pandemic because we all share that love for our students. In March 2020, when everyone was sent home, Robbinsdale EAs were still in the building every single day until the end of the school year. We passed out Chromebooks and iPads. We packaged up materials and met with families to ensure their child had everything they needed. We rode school buses each week to not only pass out materials, but to see what else families might need and to make sure they were okay. Our essential worker child care program served more than 500 kids and was staffed by our EAs. They set up their rooms with multiple children, each with their own daily schedules of login times and work to be done. We spent our own money when earbuds ran out so that students wouldn't be distracted by the other 14 classes taking place around them. Last fall, we also set up our student support centers. I met with students in person and worked with teachers throughout our building to make sure I could provide individualized support for anyone who needed it. It was fantastic to have the kids in the building, and I loved being able to see them, but I knew it came at a cost. My youngest son has severe asthma, and I had to take that into consideration every day. But I knew my students needed me. There was so much happening in their lives. They were dealing with things changing every day. I wanted to be sure that I was at least one constant for them. Over the last year and a half, our EAs in Robbinsdale and ESPs across the state went above and beyond their job duties. We were professionals in our work, and we can handle more than you think we can. We are often the lowest paid workers in our school buildings. I urge you to include the ESPs in your recommendation for this compensation. ESPs across the state stepped up when they could have easily taken a step back. We knew the risks, but we knew our students needed us, and we put them first always. Thank you.
Thank you, Ms. Bombshell. All right, so next we have Mary Solheim, Annette Salmon, and then Nicole Flick. Ms. Solheim?
Thank you, Mr. Chair and committee members. Good afternoon. My name is Mary Solheim, and I'm a director at Play School Childcare located in Maplewood. I'm also a leader with Kids Count on Us, a coalition of 512 childcare providers across the state of Minnesota. I want to share with you today Play School's COVID-19 survival story. In doing so, my hope is that all childcare settings, those able to continue serving our communities and those who have succumbed to the effects of COVID-19 will be seen as the frontline workers that they are. An open childcare setting during this pandemic made it possible for other frontline workers to continue working and serving. Play School never lost sight of how important our role was in continuing our own service so others could serve too. But because the childcare industry has been so under-supported and so underfunded, our challenges to meet the needs of our community seem insurmountable. So this is our story. When COVID-19 hit, Governor Walz asked childcare centers to stay open. We had already suffered the loss of 4 full-time staff and an almost 50% reduction in enrollment. Our income was on a steady decline, which challenged us to operate with 40% less per month. Play School houses both a licensed early childhood program and a licensed exempt school-age program. Our school-age program retained most of its enrollment, but replacing staff became impossible. Even offering hourly pay up to $18 an hour was not enticing enough to hire the quality teachers that we truly needed. Our school-age program required us to implement a distance learning program for kindergartners through grade 7. We did that throughout the school year and also through summer. An expensive upgrade to our Wi-Fi system was necessary to maintain this service. For both programs, we also followed the guidelines for increased COVID protection for purchasing additional sanitizing products, masks, PPE protection for staff, and implemented additional sanitizing practices each day. The expenses were mounting and income continued to decline. And some families were needing to postpone paying for care because of loss of changes to their own income. But we needed to stay open because many of our families are essential workers. Then COVID-19 support money became available to help centers with the increased expenses that we were facing. It was then that we received a phone call from the Minnesota Department of Human Services, the licensing department, telling us not to bother applying for it because we were ineligible. A licensing issue in appeal status that will be 2 years old in November was preventing us from receiving support for the effects of COVID-19. When asking why a licensing issue in appeal status would take precedence over the health and safety of kids that were coming every day, the reply was there was nothing they could do. It was legislation. To date, that total is over $21,000 and growing. And now we've been informed that we're also eligible for the COVID transition funds. So needless to say, our challenges still remain. Just this week, our licensed early childhood program learned of 2 children testing positive for the COVID variant. We are now closed. That license program is closed. What I want you to know is that we're going to stay open, we're going to figure it out, and every child care worker that is out there has stayed committed to this pandemic, facing their own fears of exposure and feeling outright exhaustion by continuing to provide a quality service with less. These are true heroes. Their work, commitment to kids, and the compassion they have for the struggle we are all doing together, I would hope the state will recognize. Please provide the support and the grant money for all essential workers, including child care providers, because our kids and our families deserve to be at the center of those decisions. Thank you.
Thank you, Ms. Solheim. Next, Annette Salmon, Nicole Flick, and then Alex Hennessy.
Good afternoon, Chair. Before I provide my testimony, I am wondering if it would be possible to have Alex Hennessy testify next. I do know that he needs to leave.
Yeah, and if you would rather, well, we'll go to Alex Hennessy then, and then we'll see if we can come back to you. Mr. Hennessy, or Ms. Hennessy, I guess, I'm not sure.
Mr. Hennessy, thank you, Mr. Chair, and members of the committee.
We're having a little trouble hearing you. If you could get your microphone situation set up better.
Oh, is that better? Can you hear me?
A little bit, but please try to speak up.
Sure. All right. Well, good afternoon. My name is Alex Hennessy. During the COVID-19 pandemic, I worked for the White Bear Lake School District and served as an out-of-school time program leader. And I am here to represent the emergency child care workers who provided care for Tier 1 critical workers in the White Bear Lake School District. In March 2020, our world was turned upside down. Governor Walz made the decision to close Minnesota schools and move our schools to a distance learning model due to the outbreak of the COVID-19 virus. Our team in community education was put on the spot and tasked with creating a brand new program to support hundreds of students and families across the district in a matter of a couple days. The extent of the effort and hours put in to turn around a program that fast for our families cannot be understated. We worked overnight and on weekends to meet the needs of our community, and the work never stopped. Just to add in a bit of perspective, we went through 3 different learning model changes over the course of the last school year, from distance learning to hybrid to full in-person, and then back again. Our team was asked to put our own fears, anxieties, and worries on the back burner to provide this absolutely necessary service for the families of our Tier 1 critical care workers. Employees from all levels and areas of the district came together to provide this support and had to learn on the fly brand new systems and technology to support our students in distance learning. This doesn't even take into account the emotional support these young learners needed during a time of great fear and uncertainty, while also managing our own mental health. We continued to adapt and adjust as new guidance came to us. New information about the virus came clear, and new guidance was given on how best to protect the students and ourselves. We were the people and the faces that families in the community turned to with questions, criticisms, and praise. We stepped up when the government asked us, and we never stopped working. We did not get a summer break before jumping into fall programming, or a break before jumping from summer programming back into the fall again. We continuously worked in the front lines of childcare, all while the uncertainty of whether we would be able to keep our jobs hovered over us, as we offered free childcare to hundreds of families in the White Bear Lake District who are in need of the Tier 1 critical childcare. We served on the front lines in the trenches every single day, and it is of my opinion that our team and our workers deserve to be compensated for providing this essential service to our families and our community. Thank you.
Thank you, Mr. Hennessy. Next, we will go to Nicole Flick and then Teresa Jakubowski. Ms. Flick?
Hi, my name is Nicole Flick. I own ABC 123 Child Enrichment Center in Dilworth, Minnesota, which is right in the FM Fargo-Moorhead metro area. My center is licensed for 175 children. We have been operating for almost 6 years now, and I'm testifying on behalf of my 45 employees and the employees of other childcare centers in West Central Minnesota who showed up to work day in and day out during the past 16 months and have worked for impoverished wages each day. I want you to realize how hard these people worked and how much they sacrificed for their families and the families they served. When the pandemic hit, the governor asked us to remain open so the essential workers could get to work and help save lives and stock grocery shelves. We childcare center owners and directors told our staff we have to help. Those of us who were not immunocompromised stepped up, and we worked every day to keep our doors open. Cleaning toy after toy, trying to keep infants from touching other infants, toddlers from putting toys in their mouths and sharing with friends, keeping our 3-year-old 6 feet apart, all while trying to explain to them why we can't show affection or calm the nerves of the young children, asking why people are wearing masks. We cleaned and sanitized until our hands bled day over and over for 16 months. Myself, a mother of 2, ages 3 and 6, who I own a small business. I do not have health insurance for myself or my children. My children had to come with me. They did not have a choice. If I couldn't get to work or my husband couldn't get to work, we couldn't operate. So I made the choice to come to work and take that risk, knowing that if we were to catch the virus, we would not be able to afford the medical care to save us. I made that choice because it was the right thing to do and the only thing I could do to help. I'm sorry, I practiced. My center used to be open 5 a.m. to 8 p.m. Our staff spent most of that time cleaning. We couldn't afford a cleaning service because the industry was already broken, low profit margins. Those prices have skyrocketed because everybody needed a cleaning service. We spent weeks fogging classrooms, bleaching and sanitizing toys. We ran kids to and from the front doors to meet their parents so the parents didn't come inside, because if they tested positive, we'd have to close and quarantine. Since then, we've had to shorten our hours and we've lost families because of it. We lost half of our families when the pandemic hit because our contracts were already in place and they were not required to pay me if they withdrew. I was offered loan after loan, but because I was a for-profit entity, that was all I was given at the time. Unsure if I'd be able to pay it back or not, I took it. It wasn't until about 6 months into the pandemic did the state start sending us grant money to help with supplies. They wanted us to stay open and work, but we were never defined as critical, so grocery stores would not let me get more than 1 gallon of milk at a time, more than 1 paper towel. I had to beg and plead with the managers of the stores to give me sanitizer and gloves. There was even one point where I sent 3 of my staff in to get gloves because they only allowed 1 per customer. The alternative was inflated price tags and maybe weeks on delivery. My employees stepped up more than I could ever imagine. For this and the families we serve, we are eternally grateful. They showed up. They had kids washing hands. They washed the toys. They stayed late. They cleaned the classrooms. They did their very best to calm the fears in the little eyes staring back at them. They deserve this money. Nurses, doctors, grocery store workers all receive bonuses, higher wages, but not us. We didn't get bonuses. All the money we received went to additional staffing to keep group sizes smaller or supplies for cleaning and PPE. when the cost of a one vinyl glove goes from 2 cents to 11 cents and you go through 4,000 gloves a month, you must prioritize any funds that are given. The safety was the utmost important thing for my employees. Paying astronomical prices for toilet paper and disinfectant and the necessities to keep them safe took a toll on our already broken business. Public schools were closed. We spent most of our days figuring out how to teach second grade math because we could only see the teachers on Zoom for about 14 minutes at a time. The rest of the time we had to help 15 Google Meet sessions per hour and homework for the other 15 kids that were out of school but we were caring for. We became the public school teachers for no extra pay. We were on the front lines in the classrooms with all their students, helping them with their studies so essential parents could get to work. It is so imperative that childcare workers be seen as essential because without us, you do not have an economy. Without childcare, your ER doctor cannot go to work and save lives. Without childcare, you as very important individuals who make laws and serve our communities cannot work. Without childcare, there is no shipping or delivery. Without childcare, people simply cannot work, and that's the bottom line. We've always been and always will be the backbone of this country. It's about time people treat us fairly, give us the wages we deserve so the young generation of today can lead us into tomorrow. Thank you.
Thank you, Ms. Flick. And thank you for keeping your doors open. Next, Teresa Jakubowski, Lori Stammer, Ronnie Sprigler. And I would really ask to try to keep testimony to just 2 minutes and tell the essential stories so that we can try to finish up by 2:30.
Thank you, Chairman Winkler. I would prefer to wait and do this testimony at another time. It's been a very emotional day, lots of great testimony. I can't add to this today. So I'd like to back out and let other people who would like to continue on go.
Thank you, Ms. Jakubowski. We'll try to make sure that there's another opportunity. Lori Stammer and Ronnie Sprigler following that.
Thank you, Mr. Chair. My name is Lori Stammer, and I will keep this under 2 minutes, and I will send you my full submission. So I've been a contract organizer for SEIU Local 284 for many years. I was a para for many years before that, have almost 3 decades of experience with schools between them both. I live and serve in Wright County, and then I go west into some surrounding very rural communities, LeSueur, Henderson, Hutchinson, Litch, GC, Howard Lake, Waverly, Glencoe, Silver Lake, and Gibbon, Fairfax, Winthrop. So COVID didn't hit all these districts equally. Some of the more rural districts have enough space where they actually never had to go to distance because they have a small enough student body that everybody stayed there. But universally across all of these districts, the custodial and food service folks, which is the focus I'm going to talk about because I haven't been as much here today, showed up daily to do their jobs. Not to say other people didn't, but I want to focus on these folks. Both custodial and food service staff in most school districts in Minnesota are above an average worker age. Lots of them are nearing retirement. Most districts are working understaffed and have been for years in both food service and custodians. And when COVID hit, these folks came to work and did their jobs magnificently, and it wore them out. And they not only did their work, they did all the extra work. They didn't have more hands, and they never had more money. No one in my turf had hazard pay. There are some districts in the city that had hazard pay. That didn't happen in rural Minnesota, and it didn't happen in any of my turf. So I saw a lot of exhaustion. I saw workers who are forced to produce more in less amount of time. And I saw some workers quit early, retire early, get sick and have COVID, have to stay out. Some quarantine themselves, but most of them plugged through. The big thing I want to talk about as I'm moving into negotiations for most of these contracts, we find that most districts are unwilling to even consider using their ESSER dollars to compensate hourly staff that were at an increased risk over the last year. In fact, not only are they unwilling to consider it, I have a letter exemplifying, and I'll send it to you, the training that they've attended, put on by MASBO, teaching them ways to avoid having to pay additional money out of their ESSER dollars. Specifically, This was about collective bargaining issues related to ESSER funds. And so I will pass on these documents. I want you to know that districts that got money are not using it for their workers. Now, the first fund in a lot of districts was pretty minute, and they used it for PPE and other things, and that's okay. But we're on to the third fund. It's a significant amount of money. They could be choosing to put that towards workers, and they're not. So that to rely on districts to do the right thing, I'm here to tell you that they're not interested. And that's very unfortunate. And I will submit the rest of my comments. Thank you.
Thank you, Ms. Stammer. Ronnie Sprigler?
Thank you, Mr. Chairman. Thank you to the representatives and everybody in this committee. I'm happy to be here today and be asked to be here. I've been a teaching assistant for over 20 years with St. Paul Schools Public Schools District, and I'm a member of the Teamsters Local 320. I also PCA, and I have a disabled son. We work past 40 hours a week as a PCA with no compensation because of ordinances and laws, and with the lack of staffing. I want to thank all of our educators, responders, public safety workers, transportation, nutritional services, daycares, child cares, and all of those that are so much on the front lines during the pandemic. Teaching assistants are and have been frontline workers in the classroom from the beginning. We give direct support to students, ensuring safe, nurturing, equitable, and consistent learning environments. During the pandemic, I was assigned as a student coach on a behavior team outside of my contract with no options under very difficult situations with little to no social distancing. I also was exposed to COVID-19 on more than one occasion and was not accurately notified by my district. This was devastating for me, for I did bring COVID-19 home to my disabled son and my family. Fortunately, we did not have a death. TAs had their income reduced and cut in hours because of bus duty with no compensation, and it caused catastrophic economic impact. They also are classified under our state laws for unemployment as seasonal workers, therefore do not qualify for unemployment and did not have eligibility for any of the COVID money. I would urge this committee to extend benefits equitably from frontline workers' pay funds all the way to unemployment. And I thank you for your time.
Thank you, Ms. Sprigler. I'm going to next go to, this name is going to present a challenge for me. Sebli Sebsibi.
Chair, she had to leave.
Well, I am sorry about that. Cindy Cunningham and Jamie Smith.
Hi, thank you for extending this. Let's see, so we've got everything here? Okay, thank you. Thank you, Representative Winkler, and the committee members who had to go do the rest of their job. I will keep mine brief. I sent in my testimony earlier. What I will say is just really appreciate the committee's efforts to address the complexities, and there are many, between the who, what, when, where, and why. And that is a heroic effort on both the committee and all of those you've heard from. I am Cindy Cunningham. I've been a licensed family child care provider in St. Paul for 26 years, and I'm the current public policy chairperson for the Minnesota Child Care Provider Information Network, MCPIN, which is a 501c3 statewide association for licensed child care. I am writing on behalf of MCPIN and all licensed family child care providers to request that LFCCs be included in the Frontline Worker Pay program. The pandemic has affected all aspects of life and has called many to step into the front line and make those heroic efforts. We have stayed open as requested and required, essentially, to try to move forward and keep everyone employed and moving forward. LFCCs have uniquely allowed the pandemic risk into our homes daily. Our homes are our business setting. Many family members, many providers have family members at risk, like some of the other families who have said that their children were, at risk. These families walked into our homes. We had to clean our homes, work with our homes, and try to mitigate all of those issues. We've continuously dealt with much of what everyone has heard. One of the things that has been brought forth is there has been supportive funding and support children's cabinets to the grants, and many have assisted in this family child care and child care setting. However, that funding has barely kept us afloat between the need for the cleaning efforts and everything else that we've had to do the extra work. It has not come. We are not fluxed with any additional money. We actually often had situations where clients would stay home, withdraw their children. Clients were ill and exposed and either refused to pay, or we were put into the awkward position of trying to keep our businesses open, keep the income, asking people who couldn't pay to pay. In that, clients losing their employment. Providers, family members of themselves are exposed and developed COVID-19, and our businesses were forced to close due to the exposure, and we do not get any sick time. Funds have allowed the providers only limited exposure time, so time off has been limited, and that has limited our ability to provide self-care and our rejuvenation. This pandemic's not been easy for anyone. As small business owners, primarily women and minorities in a vital caring profession, we stepped up to support Minnesota workers, and we would appreciate for Minnesota to continue to step up for family child care. Thank you.
Thank you, Ms. Cunningham. And then Jamie Smith, if you could just take a minute and wrap us up.
Yes, thank you. Good afternoon, Mr. Chair and members of the working group. My name is Jamie Smith, and I'm a paraprofessional with the Duluth School District. I am a member of AFSCME Council 5, and I'm testifying today on behalf of my local union, AFSCME Union 66. I'm a frontline worker. When the stay-at-home order went in effect last March, our students when it went in effect last March, our students transitioned to at-home learning. We, as paraprofessionals, were reassigned to help provide childcare to other frontline workers who were unable to stay home and assist distance learning with their students at that time. Without my colleagues and myself, frontline workers with young children in hospitals, nursing homes, and countless other locations would not have been able to report to work. Our pandemic response was a team effort. Please do not exclude us from the frontline worker pay. Though our schools were not COVID units, we were not immune to the dangers of the virus or the crippling effects and anxiety and fears that it brought with it in the early months of the pandemic. We reported to work without proper PPE or cleaning supplies. I worked with early elementary students. Imagine the challenges of keeping those young kids to keep their masks on, socially distanced. We also had several cases of COVID in the classroom that I worked in. At that time, we had to take 14 days off, of which the CARES Act only took care of 10 of those days. The rest we had to use our sick time for or take leave without pay. The fear of what I was bringing home to my family always was at the back of my mind, but I needed to keep working as many others. At the end of the day, we all showed up and did what is necessary to help keep our state and everyone working and fighting against COVID-19. We did our jobs. We're going to show up every day, even with the next strain, and we're asking you to do the same thing. Do your job. Honor us all. Don't leave frontline workers out. Thank you.
Thank you, Mr. Smith. And members, thank you for your patience in taking the extra time. We are not going to get to our homework assignments. I'm sure that we will all came prepared, but we will get to those next week as best we can. And I appreciate your patience. It is important that we hear as many of these testifiers as we possibly can. And with that, we are adjourned.
Recording stopped.